Hello, and welcome to today's Cuyahoga County and Board of Health media briefing. Today, we are joined by County Executive Armond Budish, Cuyahoga County Board of Health Commissioner Dr. Roderick Harris, and Medical Director Dr. Prakash Ganesh, and City of Cleveland Department of Public Health Director Dr. David Margolius. We will begin by hearing from our county and city leaders and then end with some questions. With that, I will turn it over to Executive Budish.
Thank you, Devin. Appreciate that. Good afternoon to everybody. I'm very excited to be here with two of the smartest public health leaders probably anywhere. Dr. Harris, the county's fairly new Board of Health Director, and Dr. Margolius, Cleveland's new Public Health Director. These two public health leaders are bringing a new spirit and practice of collaboration between the city and county. And we all know the best work happens for our residents when it happens together. There's certainly a lot to talk about today. The continuing COVID crisis, new variants, and now just what we need, monkeypox. Before these doctors talk about the physical health of our residents, though, I want to remind you all about a program to improve the health of our economy, an opportunity for our small business community. We have previously provided more than $12 million to enable over 1,000 local businesses to survive COVID through our Small Business Stabilization Fund and the Restaurant Stabilization Fund. But small businesses are the backbone of our community, and we realized that amount of funding still just wasn't enough. So earlier this month, we announced our Small Business Stimulus Grant, which is designed for small businesses who survived some of the hardest parts of the COVID-19 pandemic and are seeking to grow now. This new program has an eye on minority-owned businesses. Grant award amounts are larger than our earlier programs, ranging from $10,000 to $50,000. This money can be used for hiring staff, location expansion, marketing, the purchase of equipment, and anything more. The funds have the potential to take your small business to new heights. If you want to learn more about this exciting program, or you're ready to apply, go to cuyahogacounty.us/stimulus grant. Applications will be open through Friday, September 9th. I hope our local small business community takes advantage of this great opportunity. One more announcement. I've talked about this next topic before. Access to high-speed internet. It's critically important for the success of our region. We've been working for over 2 years now to get residents physically connected, and we're making great progress, going from one of the worst connected areas to one of the best. Speaking of that, I'm happy to say our work has been recognized nationally. Cuyahoga County has been named a 2022 Digital Inclusion Trailblazer by the National Digital Inclusion Alliance. Try to say that fast. We're one of only 9 counties in the entire country to achieve this designation. It's a highly competitive award. We were acknowledged for our funding of community digital inclusion programming and our work to increase access to and affordability of home broadband service. Our biggest feat on that front was our joint $20 million investment with the state of Ohio just last month to provide low-cost, high-speed internet to 25,000 households through a partnership with local nonprofit PCs for People. This award acknowledges the importance of our work. A multi-pronged approach is what makes true connection possible. Access to devices, services, and education. I'd like to thank Governor DeWine for his partnership, County Council for their support, and Catherine Tkachuk, our Chief Innovation and Performance Officer, who spearheaded this work from the very beginning. Thank you very much. And with that, I'll turn it over to Dr. Harris.
Thank you for having me today. And thank you for an opportunity for us to share a little bit of information about the monkeypox epidemic here in Cuyahoga County. I would first like to start by discussing our cases, and then I would also like to discuss our phased approach to responding to monkeypox. As of sorry, as of yesterday, actually, there has been 15,000 cases in the U.S. Of monkeypox. And of that number, 133 have been here in Ohio. And of that 133, 61 are here in Cuyahoga County. To break that down a little bit further, 61% of those cases are in the city of Cleveland, and 60% of those residents are African American residents. Of those, 79% are non-Hispanic and non-Latino. So to tell you a little bit about the ages for these cases range from 19 to 50. So we're not seeing any pediatric cases at this point, and we're not seeing any among older adults. One of the things I really want to say is that monkeypox is not an STD. It's not a sexually transmitted infection at all, but it can be transmitted sexually because of how the virus is spread. It is spread by skin-to-skin contact, and so sexual encounters will certainly contribute to the outbreak that we are currently seeing in our county. As seen in other parts of the U.S., I will say that the majority of the cases are among individuals who identify as gay, bisexual, or a man who sleeps with men, but that is not exclusive. It is just what we're seeing right now with this current outbreak. Also, I want to make sure that people understand that monkeypox is also spread in other ways other than sexual encounters. It can be spread among people who are kissing. It can also be spread among individuals who are having non-sexual encounters with skin-to-skin contact. And I think those are very key. What I also want to talk about is our response. Many people have said that our response is slow, but I would rather consider our response thoughtful. We have been working with our community partners as well as working with our team here at CCBH to make sure that, one, we're reducing stigma as much as possible in our response to monkeypox, and also making sure that we're working with our strategic partners and our hospital systems to make sure that residents get the vaccines appropriately and that we're prioritizing the groups based on their levels of risk. And so to tell you a little bit more about how our rollout has happened, as of August 3rd, we received 1,200 vials of Jynneos vaccine from ODH, Ohio Department of Health. At the time, 1,200 vials were equivalent to 1,200 doses of the vaccine. Because that 1,200 amount of vaccine was limited, we will say that many residents were at risk of potentially not getting a vaccine if everyone was coming at one time. So we made sure that our clinical partners had the vaccine on hand to see patients that they had. And these hospital systems included Metro, Cleveland Clinic, University Hospital, and a few strategic clinical partners. Come mid-August, we did receive notification from CDC that one vial will now be able to give 5 vaccines. So then our plan had to change. And so we thoughtfully consider expanding our reach to other populations. And now we're strategically planning to get these vaccines out in community clinics. So it's not just going to be our hospital partners, but we're working with community-based organizations to get these vaccines in arms in these neighborhoods where people are living, and also in venues where they may be entertained, or also where they are going to seek other social services. I will say that the planning for this new administration of a vaccine where we're giving 5 doses, and I will say 5, don't hold me to that, because sometimes we're seeing that we might only get 3 or even 4 doses per vial, but we're making sure that we are strategically thinking about how we get these vaccines to where they belong, and also making sure that we have enough distributed on both sides of town. And we're also giving vaccine to the city of Cleveland, and Dr. Margolius can share a little bit more about their efforts at the City of Cleveland Public Health Department. I think at this point, our plans are ebbing and flowing. We have clinics here at the CCBH headquarters here in Parma. We had 1 vaccination clinic yesterday. We were able to give out around 200 vaccines yesterday. We have another vaccine clinic on Friday, and you can go to our website at ccbh.net to register for our clinic on Friday, as well as a couple of our clinics that we're having next week, which will also be on Tuesday and Friday. So without further ado, I'll go ahead and turn it over to Dr. Ganesh, who will talk a little bit about the symptoms, what to look out for when it comes down to monkeypox, and also how we can best prevent it. So thank you.
Thank you, Dr. Harris, for the introduction. I was just coming on to give you a bit of a clinical perspective on monkeypox and what we are seeing throughout the county and throughout the nation at this time. Dr. Harris gave a good overview of our efforts thus far, but clinically, some of the things that we are seeing, if we're talking about when are symptoms starting and what symptoms are occurring, we are seeing people coming in with before a rash develops. We've all seen kind of pictures of the rash that are developing in people developing monkeypox. But before that, people are often developing headache, chills, swelling of the lymph nodes, upper respiratory tract symptoms such as cough, sore throat, and then also fever and fatigue. And then oftentimes after that, the rash develops. It can be a painful rash, an itchy rash that starts flat on the surface and then develops into a bump, and then sometimes where pus is coming out. And this usually occurs from 5 to 21 days after being exposed to somebody with monkeypox. It is spread, as Dr. Harris said, from direct skin-to-skin contact. And usually it can happen after only long exposures to people in a more respiratory tract kind of fashion, kind of like what we dealt with COVID, but a lot less infectious as COVID. And so it's mostly infectious as far as we know, only when you have that direct contact with the skin lesions. Once fresh skin does develop over those lesions, people are considered not infectious at that point. The risk in the community is generally low. We are seeing that slight rise in cases, but it is a slow rise that we are seeing. So generally low compared to what we have experienced and lived through with COVID. But to prevent monkeypox, we do still need to make the same precautions as we did with COVID. But also avoiding skin-to-skin contact. If you are around somebody that has monkeypox, you want to avoid people like just that skin-to-skin contact. People should be isolating if they do show signs or symptoms of monkeypox, and of course can talk to their primary care doctor for advice. And we also do have information on our website, ccbh.net, to turn to if you have questions regarding monkeypox and what signs and symptoms to look for. If exposed to somebody with monkeypox, do monitor your symptoms for about 21 days from the time that you are exposed. You can also call the health department and also call your primary care physician if you do develop any symptoms. Because there are treatments out there. Currently, the treatment right now that we have is TPOXX, which some of you may have heard about. It is an antiviral treatment that was specifically designed for smallpox, which is related to monkeypox. So we do have a limited supply, but we have distributed supply of TPOXX throughout the county to our various hospital partners, and we do have some on site here that we could share with providers if they find a patient that is high risk and requires antiviral treatment. And then to prevent monkeypox, we also have the Jynneos vaccine that Dr. Harris discussed. We did receive that small supply, but it is going a long way based on the change in requirements to be able to give it differently at a lower volume. So that increase in each vial, we have more vaccine available for more people. We are implementing a vaccination strategy that is based on the Ohio Department of Health's tiered system. So we are focusing on tier 3 throughout the county, along with our hospital partners, our community partners, and tier 3 includes people of any sexual orientation that would be at high risk of contracting monkeypox, sex workers, or those who exchange sex for money, goods, or services, people at high risk of severe monkeypox, such as those that are immunocompromised or have HIV, and those that have multiple sexual partners over the last 3 weeks, we've been stating so far. These guidances are changing over time, and we are getting updates. Currently, we are strategizing on that target group because that's where we're seeing the cases, but that will change over time, as we saw with COVID. So our strategy on vaccination will change as we progress through this together. And then, as Dr. Harris mentioned, our strategy in implementing vaccination is multi-tiered, or we are focusing on the hospitals and the high-risk patients, but also at community sites with various partners throughout the Cleveland and the county, and then also trying to set up mobile units to kind of help go after more transient groups. But with that, I will turn it over to Dr. Margolius to get the city's perspective as the new director of the Cleveland Department of Health.
Thank you, Dr. Ganesh. And so I just want to start off by thanking Commissioner Rod Harris and Dr. Prakash Ganesh from CCBH, the Cuyahoga County Board of Health. You all have just been fantastic to work with. And we're so grateful for this partnership and for you inviting me today to participate in this press conference. From the beginning, so I started in this position in August. Commissioner Harris has really just been a friend and a mentor, and really looking forward to the continued partnership with the county and with everybody individually there. So in Cleveland, as you heard, we have about 41 cases as of last night of monkeypox. Most of the folks who have come down with monkeypox so far are Black. Many have HIV. And many are just have been systematically oppressed and are vulnerable populations in general. And so I'm really grateful for the vaccine approach that we've taken with the county, in that we did not on day one just put up a website and offer vaccines to folks who had the fastest internet connections, or who were the most well off, or who were the whitest, or the least likely to live in the city. And so we've been very thoughtful with this approach, as Commissioner Harris has mentioned, and sometimes promoting the websites go up pretty quickly in New York City, San Francisco, other cities that have had higher case counts of monkeypox. And we've seen those websites sometimes crash in other cities as well. So we've been really thoughtful with our approach. This week has been a busy week. As you heard, the county was out Sunday night giving over 200 vaccines to a popular gay bar in Cleveland. We were out last night at another institution a few blocks away from here downtown, and we gave 75 doses, and we'll have another event this coming Friday on East 26th Street. And the LGBT Center has been a wonderful partner. Central Outreach Wellness Clinic has been a wonderful partner working with us, and the healthcare systems are ready to go, started to give vaccines as well. And so grateful for the media getting the word out and spreading awareness. Not all cases are the severe rashes and the flu-like symptoms like Dr. Ganesh alluded to. Some cases can be much smaller and harder to pick up. And so awareness helps with that. And above all, just the collaboration across our region has been really heartwarming, and grateful to be starting out in my new job with this opportunity to make a difference in the community. And so with that, I will turn it back to Commissioner Harris to talk about COVID.
Thank you, Dr. Margolius. So monkeypox is definitely getting much attention right now, but one of the things we can't forget is COVID still exists, and COVID is still circulating in our community. Our community level, as it has been for several weeks now, is classified as high, and that's, again, a CDC classification based on a few factors that I have discussed in numerous press briefings, but I'll remind you of this time. One is the number of cases that we're experiencing, and then also the number of COVID admissions. And then lastly, the percent of hospital beds that are devoted to COVID patients. I'll go through these one at a time, and then we can talk about some prevention measures and remind you of some of those. So as far as cases, in order to be considered high level, you need over 200 cases per 100,000 residents, and right now we're at 224. This is improving more than it over the past couple of weeks, but it was a lot higher at about 250 earlier this month. And so we're glad to see this number getting lower and lower, but we're still not at a less than 200 level where we would be considered medium. COVID admissions. We're seeing 15 COVID admissions per 100,000 residents here in our county. And in order to be considered medium, you need to be at 10 or less. This number has, again, improved, but again, we're not where we need to be, and this can be improved over time. Lastly, for our percent of hospital beds devoted to COVID patients, the number is at 4.3%. This number has been low for several months, and we're glad to see that many of our hospital beds aren't being utilized for COVID patients. This is indicating that vaccines are working and that they are preventing people from getting severely ill. So kudos to those residents that have been vaccinated, even more so those who have been boosted. We're glad to see that even if people are getting infected, that we're not seeing many people being admitted to the hospital and also having extended stays in the hospital. So I want to remind you all about a few things that we recommend given our COVID level being high. And these are CDC recommendations. And one is that we want to always emphasize that masks are important. Masks do work, and wearing masks indoors when you're at a high COVID level in your community is very important to remember. And then testing. Primarily testing if you are an individual who is at high risk for severe illness, primarily those individuals who are immunocompromised. Definitely, if you are having symptoms, get tested, making sure that, one, you're keeping yourself safe, and also that you're keeping those around you safe from COVID. And then I will be remiss if I didn't say that it's National Immunization Awareness Month. And so staying up to date on your boosters, even if you're getting your first COVID series, get your first COVID series and make sure that you're considering all of your other vaccinations as well. Flu season is approaching, and we also will have a new formulation of our COVID boosters coming in the fall. So keep your eyes out, discuss these with your providers, and make sure that you're staying up to date and other family members are staying up to date on their vaccines, boosters, flu shots, etc. And so I will turn this over back to Dr. Ganesh to talk about clinical implications and also his clinical perspective.